Good afternoon, New Mexico. It's Governor Lujan Grisham, and thank you very much for joining us today for our weekly COVID update, and to make sure that we are providing up-to-the-date information about what's occurring in the state, and to also talk about some of the negative trends that aren't exempt in New Mexico, but definitely going on around the country. I want to thank the Department of Early Childhood Education and Care for providing me with this incredible mask today with their logo. Oops, other side. This is the first official day of that department. We have an incredible opportunity in New Mexico to really change the direction and outcomes for every New Mexico student by making sure that we embrace a model from cradle to lifelong learning, that these investments, we have no doubt, will pay off huge dividends in terms of increasing our support for so many New Mexico families and really focusing on education in a way that provides the kind of starts that we need for our little ones. That's 50,000 3- and 4-year-olds, and we're delighted to welcome this brand new department. All right, we are going to start. I took my mask off, and again, I'll put it back on after I'm speaking, and we only do that, and we are distanced because it is very difficult. You are, in fact, muffled with these do-it-yourself masks. So let's go to the first slide. I want to talk to folks about the current cases. So we have more than 12,276 cases. We have 130 new cases today. We have 127 people in the hospital, 38 on ventilators. Today we have a grim milestone. We're at 500 deaths. We have 3 new deaths that we've announced today. And again, every single one of these is an incredible loss to the families and loved ones and to the entire state. And I know that it goes without saying that everyone mourns these losses, and we are send our condolences and prayers to the families. We're going to hear a little bit more about tests, but we've done 350,060 total tests statewide. We continue to lead in the country, not the top, but in the top several handful of states in terms of percentage of the population. And I want to make sure for a testing update that we now go to Secretary of Health, Secretary Kathy Kunkel. Thank you, Secretary.
Thank you, Governor, and good afternoon, everyone. The Department of Health is focusing significantly more of their resources on rapid responses. I've spoken about this before. This is a shift result that comes from the Division of Epidemiology with positive cases in our businesses and in the community, not necessarily limited to just to the individual who was positive. But as of today, we have done 238 rapid responses since May 11th. We have 28 different industries, and I've listed a few here, but what is significant is that overnight we had 44 new rapid responses. A typical day would be 6 or 7, a heavy day would be 15. We are very surprised to see 44. And those other areas where we had positives in the workplace were convenience stores, educational institutions, non-food retail, home health care, detention centers, construction, both building and roofing, a child care center, the military, utilities, psychiatric center, pest control, and an indoor swimming school. So we're seeing a much, much broader spread that, which has resulted in significant rapid response by all the secretaries and their teams. Next slide. Because long-term care continues to be a primary concern and the most vulnerable population, I've brought back again the slide from a few weeks ago. The total numbers of individuals who are in long-term care have not changed, but we've seen an increase in the number of individuals testing positive, and unfortunately in the number of deaths. It's gone up to 191. That's all I have for today. Thank you.
Thank you, Secretary. All right, now we'll go to Secretary Scrace, Dr. Scrace, for a modeling update.
Thank you, Governor. Back today with, I'm afraid, bad news, actually, about what's happening here in New Mexico. If you're watching the news, you've seen all over the country a rapid new rise in cases. Ours came a little bit later than our neighbors, Texas and Arizona, and we talked about Texas and Arizona last time, but now those numbers are coming to New Mexico. So if I could have the first slide with the graph. If you remember last week, we went over this graph, except it had one less week of data, and I had this dotted line, red line, showing that cases were gradually starting to slope up again. With eliminating that bump there, the beginning of the red line from Otero County. But we're now seeing the whole state starting to increase in its number of cases. The new red line is a much sharper upslope, and if you look really closely, you can see that the last 5 or 6 days have been particularly steep. Now, we average this over 7 days in order to take out all the up and down that you see in the graphs, but this is really, really concerning to us. And the thing that bothers me for the first time is that this increase in New Mexico is the result of a combination of increases in every single region of the state. Every corner of the state, our metro region and the central, all of them have this general upward trend. And even the two bottom lines that normally are just sort of flat and stuck to the x-axis are now starting to turn upward as well. We had a lot of great questions last week at the press conference, so we went back and researched some of those for you. And so if we could go to the next slide, one question is, well, how much of this is related to travel? How much is travel of people coming into the state affecting our case counts? And you can see this is a bar graph that goes back to the very beginning of the pandemic, when well over 50% of the cases we were seeing were people who had flown in from airplanes, New York, from Washington, or flown back from a cruise ship where they had the case. But that drastically fell off over the course of a month. There was a travel ban. You can see it was very low, but now we're seeing an increase in travel, and 8.9% through almost the end of last week of all of our cases were from folks who had come here from out of state. Now, the flip side of that is, what about New Mexicans? Are they also traveling out of state? So if we could go to the next slide with the blue bars there. And this is the percentage of cases, of all of our cases, week to week, that are from New Mexicans who went out of state. And I've given you a dotted blue line in case squinting doesn't work. We're really seeing a significant upward trend as well, where 9 to 10% now of all of our cases are resulting from New Mexicans leaving the state and then coming back. And so we don't know that the travel itself caused it, but 10% is a pretty high percent of cases in our state, particularly over the past couple weeks. And what this tells us is 10% of New Mexicans who tested positive for COVID, roughly 10%, have gone out of the state and come back. And if you look at a map of the United States right now and what's happening with COVID, there aren't a lot of safe places. I don't think there's any place you can fly nonstop to that doesn't have a rapidly increasing rate of cases. Another question that came up last week is are we seeing a change in the age distribution of cases? And indeed we are. And what this slide shows in a real simple depiction is the blue line is the percent of cases that we saw in people under 30, and the orangish red line is the percent of cases we've seen in people over 30. And what you can see is there's been a significant drop in over 30, which of course adds up to the significant increase in people under 30. But we went from 1/8, an 8-to-1 ratio of people over 30 to under 30, and now we're at a 2-to-1 ratio. So a significant increase in cases in younger people this week so far, which isn't yet depicted on this graph. 27% of all of our cases were in the 20 to 29-year-old age group, which is it's the highest we've ever had. Normally it runs about 17%. And the second largest group in terms of cases is the 30 to 39-year-old age group. So those answer some of the questions that we got last week. With respect to kids, if we go to the next slide, we try to give you an update each week. Thanks to Janice Gonzalez for sending us this data. We had a 27% increase in the number of children's cases just in the past week. Our percentage of total cases went up from 13 to 13.4. 350 new children with cases just in 1 week. No fatalities, thank goodness. and we still have only 2 cases of multi-system inflammatory syndrome. But a description of this and more data on this was published in the New England Journal of Medicine this week, which indicates it's a very serious disease that can cause serious disability and even death. To follow up on Secretary Kunkel's comments about the rapid testing, this data just came in hot off the presses from James Kenney, who is the Secretary of the Environment Department. He's in charge of rapid responses in areas with essential workers. And I'm just going to briefly talk about it. You saw the categories. The biggest one is other, because there are lots of smaller groups. But the top 3 right now are folks working in food industries, folks working in healthcare, where we traditionally see a high, 5 to 10% of cases. Retail non-food establishments, so just the stores we shop at, and then construction. Also, the other thing that Secretary Kunkel mentioned, which is really profound, and this is just in essential workers, not all the categories that we're doing rapid response in, is you can see this huge increase, a doubling of the number of rapid responses in all industries just from the week before last to this current week. And so that's something that Secretary Kunkel is managing very well, is moving our testing to really focus on these rapid responses where we know there are positive cases, to assist in contact tracing, to test all the contacts and make sure we can isolate those people and contain what could be a potential outbreak. The next slide is our old friend, the gating criteria slide. I show this every single week. For those of you who don't want to get into the details, you can just count the number of red boxes and green boxes. And this week we still have 3 red boxes, which means as we're learning, we aren't really ready, certainly, to expand any further. To do that would be out of the question. The spread rate, I'll show you some detail on. Testing capacity, I noted that number, 350,000 total tests, which works out to 1 in 6 New Mexicans having been tested, which is really quite remarkable in only 3 months. To test 1 out of every 6 New Mexicans is amazing. That's really helping us in case identification. Contact tracing, with the huge surge of cases we had last week and through the weekend, we're seeing that we're struggling to keep up with that, but still doing reasonably well. 26 hours to get a hold of the first contact. And I had a lot of emails from folks this week asking me to remind all of you that if you see an unknown number on your phone, I know sometimes we don't like to answer those, but it could be the Department of Health calling you, and to warn you that you've been exposed to someone who had a positive COVID test, that you've had significant contact with them. And so please try to be available. They usually leave voicemails. Please listen to your voicemails. Please cooperate. It really helps the state to contain this pandemic. It also helps all of us to find that happy mean of life in a COVID positive world where we can do more things. And then lastly, our statewide health system capacity, doing well. Just so you know, we monitor Arizona and Texas border ICU capacity, so we have an early warning, so we'll know probably a week or 2 in advance if they're completely filling up, so we can make additional preparations. But so far, they have capacity, and we monitor every morning at 7 a.m. Next slide is just the spread rate. We were doing so good, a little bump. We hit an all-time record low, at least in the last 2 months. And now, with the growth I showed you in that growth slide, you can see we're up to 1.2. Just if you're watching for the first time or don't remember, spread rate answers the question, how many people does the average person with COVID infect? Right now, that's 1.2. Or you could also say 100 people infect 120. Those 120 go on to infect 144, and then I can't do my math in my head after that, but you get the idea. It grows much, much more rapidly. The spread rate, some really new high levels. Remember back in the day when the Northwest was the real problem and we were seeing all the cases there? They're actually creeping up again, which is worrisome. The Southwest actually going down finally, which is good news, but then very high spread rates, 1.66 in the Southeast, a big increase in cases, lots of the rapid responses occurring down there. And then Metro, 1.37, very high, Northeast, 1.34. So this is a problem. We're seeing this growth in the spread rate, growth in 3 places, growth in cases in all places, and very, very serious news. And again, if you watch the news, you know this is happening elsewhere. Another question that came up last time was, hey, what's the test positivity rate? You know, if we do test more people, we just find more cases, and maybe things really aren't that bad. And we're doing actually very well. We have one of the lowest test positivity rates in the nation. Just by contrast, Arizona next door went from about a 5% test positivity rate to 25+% last week, as they had their huge uptick in cases. And so we're watching that as well. But when you ask questions, we do go back, we do research, we try to bring you back that data. So one of my favorite websites, especially when New Mexico was green, was How We Reopen Safely. If you're watching that like I do every day on this slide, you'll see New Mexico and almost the whole country is now red. So we're in a big surge in cases, and this means that the things we did to reopen back in late May, early June, were not sufficiently countered by actions that we all took to prevent the spread of the disease. Mask wearing, staying at home, keeping your distance from other people, avoiding large gatherings. And I'm going to wrap up in a second. Well, let's just go to that next slide. Because this is something I saw the other day about the 3 C's. They use this in Japan, but you know, if you're in a closed space with poor ventilation, that's a risky situation to be in all by itself. Also, it doesn't mean that being outside is safe. You know, we still are really struggling with the evidence on that. You know, sunlight deactivates COVID, wind carries, you know, these water droplets that can contain the virus up to 18 feet. So the evidence that, you know, the jury is not yet in on what outside is, but we know indoor spaces are risky. We also know that if you're in close contact, like you're less than 6 feet from someone and you're having a conversation for a prolonged period of time, we've talked about that a lot, that's risky too. And then crowded places. You know, in New Mexico, in theory, there really shouldn't be any crowded places, because in theory, our gathering size is 4 or less. I suppose if you gathered with 3 other people in a phone booth, that would qualify, but there's a lot more relaxation that everyone is seeing in that 4-person limit. There are lots of crowds out there. There's photos in the news, not just all over the country, but here in New Mexico. And the last point I want to make is, while all of these things are risky, if you're in a closed space, in close contact with other people, and it's crowded, that's where outbreaks occur. And I was just talking to my sister who lives in Michigan on the way up here, Julie, and she was telling me that one bar has had over 100 cases, a crowded bar in Michigan. We're seeing that kind of spread all over the country, particularly in bars. And I think it's that indoor, closed space, people in close contact. I'm not saying alcohol has something to do with it, but it certainly could. And so, and then the last thing I wanted to do, because there have been lots of questions about this, face masks, is just, you know, there's a little bit of new evidence that not only what we've been telling you, that when you wear a mask, you protect others, but there's some evidence now that it lowers your risk of getting COVID as well. A paper that came out last week that suggested 250,000 cases were prevented just in the states that required masks, like New Mexico. In an interesting spin, the authors point out that we have an increase in civil liberties, and you can bring up that slide on want to prevent another shutdown, right? Because if we decrease viral spread, particularly in people without symptoms, we'll have more places open and we can do more. Now, the last thing, I get a lot of emails of people ratting out their friends and family members for the ways that they wear their masks. And a study came out that showed that only 42% of people wear their face covering correctly. So I just want to go through it really quickly today. Be a little tricky because I'll have a mask on, but this is sort of the horizontal mask, and there's several principles. One is you want it to cover your nose and mouth. You would think that would go without saying, but it doesn't. And you want it to be fit tight on the top and the bottom and the sides. You don't want to have a big giant air hole in here, but you want the mask to be snug. This is sort of a horizontal one that fans out. Thank you to Jody McGinnis Porter for making this for me. Here's another one that's sort of the vertical mask like the governor is wearing today, and that you want to fit tight. Those tend to bow out a little bit around the nose because it pushes out at the top and around the chin. So you want to tighten your straps to make sure that's very tight as well. This is an N95 I found in my garage. We're reserving these right now for the most part for healthcare workers, first responders, and the like. But I bought these years ago for the woodworking that I do as a hobby, or used to do before the pandemic. And the key on this one is, while not for the general public, they work best when they're carefully fitted. This is something my wife does, and they put you through a fitting and test your sense of smell and see if particles are getting through. And then lastly, just ways not to wear a mask. I did an excursion over the weekend, heavily protected with eye protection and a mask myself, and I actually saw people wearing masks in the following ways. So there's this one, the chin mask. And remember, COVID is a respiratory virus. It can get into the body through the mouth, the nose, and actually water droplets in the eyes. So protecting your chin doesn't work. Even more common method is this one. And just as a reminder, when we test for COVID, we put the swab in the place that has the highest amount of virus, and that is where? In the nose. So walking around without a mask, if you're an asymptomatic COVID carrier, you're shedding virus in your environment. I saw some people with this version too. I didn't really understand that. This is one I use in the car when I'm all by myself, but the mask only works, it only protects others, and now we know it only protects you if it's covering the nose and the mouth. Dr. Ramo's been sending emails to me. We've been chatting about face shields. We'll talk about that next time. I have one I ordered, and when that arrives, we'll show you a little bit about that and the advantages. And so my final slide is that nothing about the virus has changed. It has remained constant, but we can't really do any additional opening unless we're willing to do more as a people, wearing our masks, keeping our distance, to keep the spread of the virus down. We want to send kids back to school. We're not on a trajectory this week to send kids back to school if the virus cases keep growing. And we can't afford the results that Texas and Arizona are seeing with filling up ICUs and massive increases in cases. And now New Mexico is getting worse. First time we've had to report that. So we have to remain vigilant. And as the governor and others will remind you, stay at home, wash hands. Everyone should wear a face mask that covers your nose and mouth, please. And lastly, keep that distance from other people. Avoid those crowds. Avoid close contact. And with that, I will turn it back to you, Governor.
All right. Thank you, Dr. Scrace. All right, so I'm sure that wasn't news that New Mexicans were hoping for, right? We want to believe that the precautions that we're taking and that we're all being vigilant, that we were an early state at closures, an early state at education, an early state about requiring face masks, that activity was intended to create the kind of public behavior and response that would allow us to introduce risk. And of course, the issue we're really working to address, in addition to supporting our economy, figuring out a way to live with this virus that is still here, but to make sure that we are able to meet our target, which is to reopen schools. And in this environment, the country isn't meeting that criteria, and quite frankly now, New Mexico is not meeting that criteria. So let's go to the first slide. So we have a new public health order. So beginning today, notice it's for a couple of weeks, through July 15th, everything on reopening is on hold. So we're not going to phase 2. Any businesses that have not been allowed to open are not going to get to open for the next 2 weeks at least. Why is it 2 weeks? Because we need that amount of data. Now, I also want to remind you as we go through here that we're going to see another week where we expect that the numbers will increase. We hope slightly, but we introduced the second round of phase 1 openings in that time frame, and New Mexicans, unfortunately, don't appear, based on the numbers and the rate of infection, to be very compliant. Plus, we have many New Mexicans and many businesses who call us on our contact line and report that they're upset and worried about their own health and safety because New Mexicans are not very compliant. So all the restrictions and the occupancy limits, as you heard from Dr. Scrakes, are still the same. What does that mean? That we have a stay-at-home order. We want you to stay home. Did we open more businesses? We did. If you have to go out, go out. But you have to, that businesses has to have COVID-safe practices, so do you. We are now reapplying the 14-day mandatory quarantine for all out-of-state visitors. All right, if you're flying in, you're quarantined. You want to drive here for vacationing? You're quarantined in your room. Without these quarantines, given the spike in cases and the positivity rate, the likelihood that that comes in across our borders is incredibly high. And so we've got to adhere to this, and we are putting out that information through our tourism industry and everyone else, and we will enforce our staffing at the airports to remind travelers that they have to meet a 14-day quarantine, and we're going to work even with our federal partners to get them to go back to their early March and April and May efforts where they did not have out-of-state travel for including their federal employees. Our mandatory face coverings in public are now going to be aggressively enforced. So in addition that people aren't wearing them right, you're not wearing them. And we are seeing trends, particularly, and we're seeing an uptick now, as you saw, in younger populations who are infected, who are not wearing masks anywhere. Restaurants, grocery stores, out getting gas, convenience stores, anywhere they're going, they are not wearing masks. Well, again, this creates a problem for everybody who's adhering. You're making it unsafe for them, unsafe for yourself, and we continue to see increases in the spread of the virus. We see increases in the spread of the virus. The worst situation is people will die. But in addition, kids can't go to school, businesses can't stay open. Because if we don't flatten the curve again and protect our healthcare workers and protect New Mexicans, we can't reopen. And in fact, if it gets worse, then you have to roll back like most of the other states with these huge spikes are doing. They roll back. What happens to businesses when you roll back? They're barely keeping afloat today. A safe reopening is respectful and fair to those businesses, but that means you have to wear a mask and they have to do COVID-safe practices. If we don't do that, then the only recourse is to roll back. So businesses, you must require customers to wear face coverings. If you don't require them to wear face coverings, then there's a penalty to the owner of the business. Violators putting our state at risk are subject to a $100 fine. In the same way, you're subject to a fine if you don't have a seatbelt. I really want to focus on that because I am sure that there's going to be someone somewhere in New Mexico that assumes that we take great pleasure in redirecting any of our public resources to enforce against businesses and violators. I want to make everyone in New Mexico be very clear. We take no pleasure. We really worked hard to demonstrate that we could be a cohesive response state. There is no federal strategy. If the federal strategy early in this pandemic had been to require all Americans to wear masks, more things would be open, fewer people would die, and the rate of infection and transmission for the entire country would be much lower, which has been proven to be the case in all these countries and, frankly, continents around us who did exactly that. And we are refusing and failing to do it as a country. As a result, I think it's weighed heavily on too many New Mexicans who just don't believe it makes a difference. It does make a difference. And I worked diligently with you. It was a partnership not to have to go to mandatory masks to start with, and to secondly, to just use positive reinforcement by our peers. And that isn't working, so now we're going to do enforcement and hold people accountable. I have to protect the kids who need to go to school. I have to be fair to the folks who are adhering, And as important, the businesses who at great risk and expense are requiring masks or engaged in COVID-safe practices, we owe it to them to make sure that, in fact, we are all credible and accountable and in this together. So, key takeaway, when they're talking about the other states around us, they're not excluding us because everyone in the country thinks that we're okay. And in fact, we had a visit from Ambassador Deborah Birx, and they look at our border data, they look at our county data, they look at our zip code data, and our little shift, our 7-day average, along with 45 other states, that is increasing. When you look at the 7-day rolling average the week before, these are all incredibly concerning. And if we don't get it back under control, you heard me about the openings and about kids, but worse than that, we put our healthcare system at great jeopardy, in addition to the fact that we will increase the death rate in this state, which is unconscionable. So we have time. I mean, that's the good news. We have time. We can get through this next week. We can really change our personal behaviors and habits. We can all stay in this together, and we can bring that curve right back down. But we have to do it right now. Next slide. All right, and because of the things that I've been talking about, I know that folks are really, really anxious about the next set of services, but we are pausing reopenings and we're working hard not to reverse our high exposure services. And make no mistake, in the states next door to us, it's bars, which we did not open, but it would be breweries, and it would definitely be indoor dining, which is getting rolled back all across the country. If we don't want to end up in that situation like Arizona and Texas are closing gyms and salons, New Jersey just canceled its plan for in-person dining. If we don't want to be in those situations, the next 14 days with a 7-day review that's coming up is critical. We have to show that we're reversing the trend. All right, nationally, and the trend lines in our state are endangering lives and livelihoods. And I already hit this really hard, but it's right on the slide. Let's do it again. The children in this state and the students deserve a chance to go back to school. They want to go to school, and their parents want them to go back to school. They deserve an education, a solid foundation, and the kind of social experiences that they're not garnering because of this pandemic. If we don't get this right, it basically says to them, you weren't important enough for us to get this right. They are, in fact, important. And I don't want to end up in a situation like our neighboring states where you have positivity rates that are doubling every week and are seeing your ICUs full to capacity before we make decisions. We're going to do that before that happens and reflatten our curve. There's no reason New Mexico has to be out of control. Next slide. All right. So, and again, as I'm looking at my slide, it's really much of the information that I've already given. I want to do 3 things, so I'm not going to read this slide. I don't want people in New Mexico to be angry. I know that that is going to be hard. When you have anyone in government that tells you what you have to do, our natural reaction as strong, independent people is to reject that. This is a public health response to a public health emergency. We have to do it. 2, you're going to be disappointed. We have isolation and pandemic fatigue. Everyone does. We want to be outside. We have the best weather in the world. And even being outside poses risk if you're coming into contact with other folks, and particularly if you're not wearing a mask. And we're getting reports of adult softball teams playing, no masks, of having large gatherings in our parks. I'll give you an example. Albuquerque, Tingley Beach, no masks, people coming into contact with each other. I get it. I have isolation fatigue too. Every human does, all ages. But you have to resist the temptation that you would go out, A, unnecessarily, and B, that you would go out without washing your hands, having a face mask, wearing gloves when that makes sense or is appropriate, and that you're really mindful that if we don't get it right together, we don't get it right. which means we have to reverse and go to a nearly complete lockdown. We aren't there yet, I don't think, because the data doesn't say that there isn't time to shift our behaviors. Do I have another slide? All right. So I'm ahead of myself, which that's good. We can beat the trajectory, all right? So let's just go back and make sure that people are really clear, particularly for those folks who are joining us. You must wear a mask when you are in public. You and all of us must avoid groups, congregations, and gatherings, all right? We have limitations on where you can do that. My advice is, don't go to any of those if you don't need to go, because it will really help us reduce the rate of transmission. You must remember that this virus travels with you or comes home with you. We advise New Mexicans not to be traveling out of state, not to be traveling unnecessarily in their communities or cities or even their neighborhoods. You must stay home again to the greatest extent possible. I already said do not travel out of state. And we must remain home, and you got to physically distance yourself this weekend. And I am sure that's going to be the hardest news to hear today. That what we do for the Independence Weekend, what we've done for 225 years, is we've had picnics and we've celebrated with our families and our friends. We've had large backyard barbecues. We've gone to huge gatherings to see incredible fireworks displays, to show our patriotism and our pride. We've participated in parades. You cannot do that this weekend. The behavior this weekend alone can be sufficient to create incredible transmission and risk for everybody else in the state. We've asked every community to cancel their parades unless there's no spectators, everybody's wearing masks and you're in your cars, and even then, it still creates a risk. Why does it create a risk? Because you got outside of your home to start with. If you want to watch fireworks and they're being provided by your community safely, because it's also fire season, then do so from your backyard. Do not have a large family gathering. You look at the data, including in New Mexico, family gatherings are a contributing factor to the increase in spread. Do it at home. I plan on, watching a patriotic movie and doing everything I can. We're going to do virtual 4th of July kind of a celebration from the governor's residence. Nobody wants to let this incredibly important holiday go by. But if we want next year's holiday to be incredible, this one has to be COVID-19 safe. I already talked about parades, and I know that this is going to come across incredibly harsh. Americans should be proud of our independence and of our 4th of July celebration. And like so many of our beloved institutions, the Balloon Fiesta and the State Fair, we're gonna get to do them again. Of that, all of us are convinced. To do that safely and to save lives, we have to give up some of the ways in which we practiced these incredible holidays and celebrations this year. And then we can do them again the way that we always did next year when it's safe. All right, next slide. All right, so here's what you should expect then. We're basically not rolling back. So the public health order is exactly as it was, except we're going to enforce face masks. And we are going to do that, businesses and individuals, that we're going to closely monitor for the next 14 days, So we'll be back to you before July 15th to show you what's going on. We do expect our cases to be at, they're at 130. They're down a bit, but they're still way too high. You saw that our rate of infection, our average is still way too high, with very concerning increases in too many of the regions of the state. So we expect that the next several days, 7 days, is going to be more of the same, because it's how it catches up with us when people weren't wearing masks and we're not socially distancing. Then we should expect that if our behaviors improve, and I expect that they will, then we should see a flattening again, and our goal should be to reduce the number of cases every single day. We're going to continue to test aggressively. We're going to continue to identify and isolate individuals. Again, if it doesn't do what I expect it to do, what we all hope it's going to do based on these shared responsibilities and behaviors, it is possible that we roll back openings. We cannot increase the number of cases and the rate of transmission in the state. Again, we can do this together. We flattened the curve once before, and I have no doubt that we are able and we will together flatten it again. All right. I really appreciate that you let us repeat this information. We know that it's hard. I think people are likely to be disappointed about the 4th of July and the lack of activities and the strictness and the enforcement activities and the 14-day quarantines. But we believe that they're absolutely necessary. And we agree with the public health experts, both locally, thank you, cabinet secretaries, and nationally, that what we're seeing is incredibly problematic in this country. And we should be working together to change that course. We have an obligation to do it, but we have the power to immediately do something different in New Mexico. All right, Nora, I'm ready for questions.
Okay, thank you, Governor. First, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you are unmuted. Go ahead and ask your question.
Yeah, thank you. Good afternoon, and thanks again for the opportunity to ask questions. Kind of generally speaking, I think a lot of New Mexicans want to know kind of what's the driving factors behind this recent uptick in cases, and if you've been able to identify, whether it's tourists from out of state, protests that have been happening, the general reopening of the economy, or kind of what factors have been pinpointed as maybe contributing to this surge?
Dan, I really appreciate that question, and it's one of the reasons that Dr. Scrace provided, an uptick in where we see cases in terms of the businesses, and that's why we do a rapid response. Like many states across the country, we haven't seen yet that protests in and of themselves caused a jump or a spike in the 14 days. But, we're still sort of a week, 10 days out. I don't know that, and I'll get corrected, and I should, by the public health experts. Hard to say whether we will see an increase. What we think is going on, and frankly what we projected would go on, that yes, if you're coming in from another state or you're going to another state, we increase the risk of bringing the virus in, and we've got some key examples of that, and we can provide them again in answering this question, so I'll go to Dr. Scrace. But in addition, that the more businesses that are open, and again, I'm not working, and I hope that that doesn't come across this way, we aren't vilifying businesses, except where we have a business that is not practicing COVID-safe practices, and there was a New Mexican article about an Applebee's, and I think it's a really good example where the manager allegedly, according to the article in the paper, says that individuals who felt sick were required to go to work. So first of all, that is bad practice in every workplace. Secondly, it's an incredibly bad practice in a restaurant where there's food delivery and food service. And lastly, in a pandemic, no one sick should be leaving their house for any reason. Turns out the individuals tested later to be positive. These businesses will be held accountable, get shut down, and it's exactly the reason that good businesses, in terms of practicing COVID-safe practices, investing in that, protecting their employees, they get caught now in a situation where we have increased spread and they're at risk of not being able to maintain their business opening. The more places that are open, the more places people go, the fact that we're not very mask compliant. If I were, without investigating, to believe every single complaint that comes in to our complaint hotline, 85% of New Mexicans are not wearing masks. Anecdotally, to myself and others, looks to me like we get about a 40 to 50% mask wearing in many communities. Albuquerque started strong. It looks like they are really beginning to diminish. Santa Fe, typically strong. There's an allegation that the folks who don't are tourists. I think that there is some truth to that, but we really got to peel back the layers and look at it. What I can do is just say everyone's required. Let's make it really clear, and if you're not wearing a mask, I will cite you so that it's fair to everyone. And we know in the counties like Lee and Eddy County, which aren't really mask compliant, you're now seeing an uptick. You're seeing more of a rate increase in Lee County than you have now in San Juan County. These are all very troubling statistics, and it's all of the above. I mean, that's the reality. It is all of the above.
Yeah, thank you, Governor. I would just sort of reiterate I would start with the reopening on 6/1, the fact that we relaxed restrictions. We expected to see an increase in cases, and we're learning from watching other states that it's 4 to 6 weeks after that reopening that we see the uptick. So that'd be first on my list. Tourism, we already talked about. 10% now of cases, people coming in from out of state. Another 10% New Mexicans traveling have traveled out of state in the previous 14 days. I didn't show our mobility data, the cell phone mobility, but that continues to increase. Some regions of the state are very close to pre-COVID levels of moving about, and we now know, thanks to our help from our partners at Los Alamos National Lab, that mobility highly correlates with new cases. And then just, please don't come to work if you're sick. And employers, please don't let your employees come to work sick. And employees, if you're told you have to come to work, even though you're sick, don't go. I know that could cause consequences, but it's just not safe for you or anyone else. And then the other thing I had on my short list is large family gatherings. I think there's a belief that the public health order, when it says no more than 4 people congregating together, somehow exempts families. So graduation parties and other coming of age events that families like to share in together are contributing. And then just, I think, like the governor says, all of us wearing a mask, wearing it properly, covering our nose and mouth every single time we go out. I think we have a ways to go. And my hope is that we see a huge increase in mask wearing that will make a difference in spread, bring those numbers back down so we can do those things we're hoping to do in terms of restarting schools and reopening other businesses as time goes on. Thank you.
And Dan, something else, and again about mask compliance. I do think that people have a real false sense of security. I'm young, it won't matter if I get it. I don't know anyone who's older, I'm not really going to spread it. All untrue. And this notion that New Mexico flattened the curve, we had some, good days in a row with reductions in many regions, some counties in the state with no cases whatsoever. This sort of notion that, well, it's only 17 cases. But if you're doubling, right, and your rate of infection is higher, you're at real risk. And just sort of this sense of it really isn't something I need to worry about. And that general attitude, now all across the country, but also right here in New Mexico. When I see elected officials in an event on Facebook speaking to a group of 30 or more outside with mariachis behind them, blowing horns and playing and singing, I am clear that they have violated the public health order, certainly violated the spirit of we should be doing all of this via the internet. And singing and blowing into a musical instrument is the highest possible risk. And do I think people in general are purposely trying to spread? I don't. I do think failure to adhere to the mandatory masks has led to where we are in large part, and it is really disappointing that because we have the power to protect each other, that we didn't. And I just think people have gotten very relaxed about it, and they should not be. It is here. It lives among us. It is incredibly contagious, and it is incredibly dangerous. And if you're looking now at the hospitalizations in other states, it is younger people who are now hospitalized. And a certain percentage of those individuals hospitalized are going to have two issues. And we're learning more about this virus. One, they're going to be on a ventilator, which is dramatically increases lifelong significant chronic healthcare risks if you live. And two, folks who are fortunate enough to beat back the virus after being hospitalized so that they don't need a ventilator and respiratory assistance in that way, we are still finding that they have lifelong chronic issues that are very concerning and problematic. And I think this notion that many of us, many younger individuals sort of feel like, I'm not going to get sick, so it doesn't matter. It does matter. You are going to get sick. You are going to transmit the disease. People will be in the hospital. People will die. And if you're looking at the hospitalizations in Texas and Arizona as examples, huge uptick in 25 to 40-year-olds who were sick and in the hospital.
Thank you, Governor. Next, I'm going to go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question.
Thanks, Governor. And I joined you late, so if you've answered these, feel free to just move past them. One, I wanted to ask you about the ins and outs of enforcing that quarantine for people who travel here. How does that happen? Is it more or less voluntary? And then secondly, there seems to be a trend nationwide of governors sort of deferring to either county level or municipal level people to use their judgment for public health orders. Can you talk a little bit about your view on that? Thanks again.
Yeah, thank you, Matt. And shame on you for not watching the whole thing. Matt, thank you for your question. So I'm going to do the second part of your question first, which is, well, I'm going to make all the viewers a little nuts. I apologize to you. Look, enforcing the 14-day quarantine is tricky, and I want to be careful that it's all voluntary. I don't always know, the state doesn't know, right, who comes in. But if you're staying in a hotel, we are asking the tourism industry to help us enforce. We also can get a sense that if you're not wearing a mask and we cite you and you're from another state, in the same way if you were in a rental car, your own car, and you have a traffic violation, we would in fact give you a citation. We know you're from out of state. We can get a sense about who's coming in from the airports. We don't track you to where you go. We don't put, I mean, there are countries who do that. You can't leave your apartment and go anywhere unless you're allowed to go to the grocery store that day. That's how many countries dealt with this problem, this pandemic. And if you're coming in the airport, you're escorted to a quarantine site. We aren't going to do that for a number of reasons, not the least of which we don't even have the manpower to do it. But I will say that there is a growing sense by New Mexicans and industries who are calling us, who know that we've got a tourist population, and I'll give you an example, and this will help us. President Aguilar from the Mescalero Nation asked us before, now we'd already made the decision, but right before the press conference reached out to me and said, what can we do about out-of-state tourists? Because I'm getting really good compliance from New Mexicans who visit our convenience stores about mask wearing and social distancing, but we're not getting it from our out-of-state visitors, and what they say to us, we don't have to in our states, we're not going to do it in your state. And he asked us to do something about that, so we're going to have a robust partnership with all of our partners so that we can enforce both a 14-day quarantine if you're out. Did you finish your quarantine? Where did you finish it? And that's why we need all these contact tracers. So you've got a violation, then we find out about it at health, and we can have include that in our rapid response. I just want to be cautious that we think we have vehicles that will help us engage better in that regard. It is not perfect. It's not perfect at the airport. It's not perfect as you're driving through but not staying. And it's not perfect even when you stay. But we're going to be paying a lot more attention, and we're going to ask New Mexicans not to travel. And Nora, tell me what the second question is again.
I didn't catch it. I'm sorry.
Some governors defer to county levels. And
Thank
what
you.
about our
And I
state?
need help with that, and I apologize. I'll try not to be as long-winded, and I know the people who are viewing this would like that too. But they're not yes or no answers. Look, New Mexico has a statewide public health system. There are a lot of states that don't have that, which means that your public health system, particularly in states with much larger populations, you're going to have sort of state factors and social determinants of health that are very, very differently county to county, say, like in California. And so you have different ordinances, different requirements, different opening policies. I will say in a pandemic, my view is this: it becomes very complicated to really manage a statewide response if you don't have a statewide mandatory and proactive effort that is applicable in every city and every county. I think it's incredibly hard to manage, and you can see that it's caused real consternation. So you've got a mayor in Georgia who has one set of criteria and circumstances in a state that's doing something else. You have counties in Florida who are restricting or opening bars, one or the other, and a state that's trying to figure it out differently. You've got California in the same spot. I do think states like California have the ability to overrule some of that. Some states you don't. That the county public health leaders unequivocally get to make those public health orders and restrict them to those counties. I think it's really complicated, and I believe that the better outcome is having a statewide system. And I certainly don't want to minimize the incredible local leadership in our state and the incredible local leadership around the country. But I think that most experts would agree. I need to check this, but I believe that most experts would tell you it's a much easier system to manage. And it's really now what we're all saying. If we had a federal public health system, and there had been a federal mask requirement, and there had been federal interventions, this whole country would not be in the situation it is in currently. And the countries that had a national plan with a national effort are not having the same experience as we are. And it's exactly why we're now watching the European Union have a discussion, debate, and set requirements that may not allow American tourists to enter their countries. We don't have a national response, and we have a huge uptick in national cases. Thank you, Dr. Scraggs. Next question.
Thank you, Governor. Next, I'm going to go to Jens Gould with the Santa Fe New Mexican. Jens, you're unmuted. Go right ahead.
Thank you so much, Governor. Thank you, everyone, for the opportunity to ask some questions. On the first on schools, you've talked a lot about schools. How likely is it that schools will not be able to open in August, given the data that we're seeing? And then regarding the travel enforcement, I would think that practically ends for now the tourism industry in the state. I mean, I don't know a lot of tourists who come for more than 14 days. Is that basically what we're saying, that we're not going to have tourists really in the state until this this order is lifted? Thank you.
Yeah. Tourism is really hard, and the tourism industry, hotel, lodging, entertainment, food, has been dramatically negatively impacted by this pandemic. And yes, if we've got folks who aren't willing to do that quarantine, that becomes really problematic, particularly for our hotel and lodging industries. We also have communities that really, the whole state of New Mexico is reliant, and thank goodness, it's an incredible, notwithstanding a pandemic, it's an incredible economic sector. It's clean and green, and it really promotes every region of the state. But in a pandemic, traveling, particularly in areas that have different rules than we do, and higher infection rates, right? We just keep inviting more of the virus, which already lives here, to come in here. That is really problematic, and it shifts our ability to do anything else in the state. So we are asking New Mexicans, think about a staycation. Wear your mask, make a hotel reservation. Maybe this is a great holiday weekend, 4 days, to support a local hotel. We still have folks who are using many hotels as lodging, so I'm hoping, not lodging, I'm housing in a variety of places, including in our energy counties like Lee and Eddy. We're still using hotels to help us with isolation support in many counties, but particularly in the northwest region of the state. So I hope that it doesn't create any more significant damage to the lodging industry, but it's a risk. But I have to weigh those risks with what do our case strategies, what does it look like, and are we making an impact in lowering or flattening the curve, and we're not. Yes, I recognize what that does to tourism and what that does to an industry that's reliant on folks, and but I don't see a productive way without a 14-day quarantine. I need to make that applicable to everyone coming in from out of state. And it will limit then workers traveling and their employers from wanting to do that. And that also helps us flatten the curve. And why? Because I'm cautiously optimistic that we're going to see the negative impacts of poor personal decisions, the fact that we opened up, we invited risk, we asked New Mexicans and others to help us make sure that we said that we had controllable small increases in cases and then a reflattening, and that does not appear to be occurring. If we don't do something dramatic now, then not only do you have all of the problems we've always discussed, deaths, hospitalizations, rate of infection is higher, but it means that you couldn't safely open schools. I'm still cautiously optimistic that we're making the right proactive decisions that we should. And that's exactly why we're not going to introduce any more risk, and we're going to really enforce masks. These two issues alone put us in the best possible position to protect school students, school-age children and their families, and make sure that we can safely reopen in August.
Thank you, Governor. Next, I'm going to go to Julia Goldberg with the Santa Fe Reporter. Julia, you're unmuted. Go right ahead.
Thank you, Nora. Thank you, Governor and Secretaries. I note that our hospitalizations and our deaths have been declining. Is that purely accountable going backwards to when our cases were lower? And I guess I'm wondering what that time period is in which hospitalizations and deaths show up. And then my second question related to testing. I know our testing is up, but I've been reading that nationally and in our nearby states, anticipation of another shortage of testing supplies now that there's so many spikes happening. I'm wondering if you anticipate or are encountering that as well as we did earlier in the pandemic. Thank you so much.
Thank you. And actually, I'm going to do it again. I'm going to do the last question first. I'm going to answer that. You're going to make sure that you answer the question about hospitalization and death rates. Dr. Grisham, anything you want to add about testing, Secretary Kunkel? There is no question in my mind that there is there's a worrisome issue related to having enough testing supplies. So I just want to make sure that New Mexicans who are viewing know that we're really talking about three things: swabs, the test tube or vial that you put the swab sample in, and then a reagent. That is what you need in order to take that sample that you took from someone's nasal passage with a swab, the test tube with the saline or the liquid in it that preserves the sample. Then it goes to a laboratory and it gets loaded into a laboratory instrument. Each laboratory instrument that is approved to run a COVID-19 test, all of them have different sort of proprietary reagents that they use to pull out the virus and tell us whether we've got a positive or a negative. I spent all of the latter part of March, April, and most of May chasing those supplies, like every single governor in the country. We were more successful, and that's great. But it is clear now with the rise in cases The clear evidence that testing asymptomatic populations is critical. We were doing that, but most states were not. Part of it was they didn't think that they needed to, and the CDC didn't tell you to, and then they didn't have enough supplies to do that, so only sick people or healthcare workers. I mean, they were very narrow. Now that we're seeing an explosion of cases, the need to adequately test your populations so that you can do something about your outbreaks has caused a real strain as we see an uptick in testing supplies all across the country. You might have heard yesterday, and of course, we had a visit on Monday from Ambassador Deborah Birx in the state of New Mexico, who is traveling many states and meeting up with the Vice President, talking about a number of COVID-19 pandemic response issues. And testing is an area that she has expertise in and is focused on. And she's asking many states, including ours, to do something called pooling. So you have to answer both questions, Dr. Grace. And pooling is where you take multiple samples. So you'd have one test tube, anywhere from 3 to 10 samples in a test tube, and you run that one test tube. If they're all negative, you know that you've got a batch or an area that you've done testing that's all negative. And that way you could run many more tests because it's one reagent. Same number of swabs, but fewer test tubes and fewer reagents. We're going to help do some pooling, and we're going to use our public health experts to decide where. You're going to hear about some negative issues related to that. Why would we go to pooling when we need to know immediately? Because if you've got one positive, then you got to go back to the whole batch and test them all again so that you know who is positive. They're doing it because we don't have enough testing supplies in the country. And it's the only way now to kind of keep up. It's a strategy to keep up with testing. I made an arrangement that I think is productive. They need research. I want to test out pooling. I want to figure out what we know about what our maybe safer communities are and why. But only if all the testing supplies that we need in the state, because we're just over 16% of the population, as you heard. When I was 6, we need to get to 25% of the population and greater during this pandemic. So the federal government has assured me we're going to get our testing supplies and we can do pooling. But no question in my mind, no federal strategy, no effort to increase testing supplies, and there's another backlog, and it's going to be as precarious in the situation that we're in as PPE is. And in fact, PPE, because we're not really manufacturing it in our country, is again going to be a problem, although other countries are doing better in the pandemic. So maybe that competitive problem we had early on in April and May will be somewhat diminished, but we're going to be aggressive in New Mexico in the same way we always have been. Otherwise, I can't protect New Mexicans. Dr. Grace.
Thanks, Governor. First on pooling, not to be too negative, but one of the issues is just that the concept makes sense, and success is when you, let's just say, combine 10 specimens and get a negative. That's success, because you're assuming that all 10 of those people are negative. Laboratory leaders have a concern, though, that we could dilute the amount of that one test if you had too many samples mixed together and potentially miss a positive test, so that's a concern. I would be concerned about the variability between machines and reagents and the interactions of the reagents, and so we would certainly test this theory in New Mexico on our key machines, because we have, as you saw, 300,000 tests. We have the materials to test them ourselves and verify whether that'll work. And then the last thing that we have going for us on pooling is the fact that if you have a low test positivity rate and a low prevalence, like we do, one of the lowest in the country, you're more likely to get that good result of all 10 being negative. If 3 out of 100 are negative, then you can imagine that you could, 7 of those series of 10 samples might be negative, and that would save reagent. To the other question, Julia, good question. This has come up a couple times this past week. Hey, cases are going up, but hospitalizations are going down and deaths are going down. How can you reconcile this? And the answer, we talked about this at the modeling team actually at some length yesterday, is that there's a lag in there. And so one of the things I've observed looking at other countries, looking at New Mexico, looking at other states, is you see this uptick in cases, and then about 2 weeks after that, you see an uptick in hospitalizations, and then 2 weeks after that, you typically see an uptick in deaths. So we were talking about that yesterday. That's a common observation. Los Alamos National Lab has been studying this all over the whole country, confirmed there was the lag. They pointed out I was wrong. It's not 14 days, it's 13.2 days lag on average between cases and hospitalizations and deaths. And so I would predict that with this big case increase, a couple weeks out, we'll see another uptick in hospitalizations. A couple weeks after that, sadly, another uptick in deaths. Thanks.
And Julia, for all the lay persons, I view it in this way. When you initially get a cold, those symptoms are mild, you don't feel bad, and then it's a really bad cold, and a week later you've got bronchitis or a sinus infection or pneumonia, or maybe it's 7 or 8 or 9 days later. The same thing often if it's not that 24-hour flu, but you get progressively worse, and then there's the hospitalization. It doesn't quite translate to that data, but it's another way for a layperson that this is why we look at these trend lines over these 14-day periods, so we can tie them back to different decisions, different activities, different accessibility, people moving around, not wearing masks, and when we see folks, and depending upon the population infected, how quickly it takes them to start to have severe symptoms that do require then hospitalization. And it's not the same, this is where I'll get into trouble, and I should, by the public health experts in the room, which is it's not true. I mean, it's not the same for every person who gets COVID. We know that already. Some people have very mild symptoms, some people are asymptomatic, never know, and some people in short order become very, very critically ill. But there is sort of a general aspect that as you have this virus, you get sick later, and we're going to maybe see this play out exactly in 13.2 days. So thank you, Dr. Scrace. Next question.
Thank you, Governor. Next, I'm going to go to Algernon Damassa with the Las Cruces Sun News. Algernon, you are unmuted. Go ahead.
Thank you, Governor and Secretaries. I'm going to turn to the question of the situation in our prisons again, since that has not come up much. And just to point out that nobody was sentenced in a court of law to be exposed to a potentially deadly respiratory disease. And the state's ability to deal with facilities that also house federal inmates as well as privately operated businesses may be limited, but still the question is, are we helpless to do anything but watch the disease make its progress through these congregate settings, or is the state investigating other measures it can use to enforce safety measures in these facilities?
So I have to say that actually I really appreciate that you asked this question, because it's a really important question, and you are right. And it's one of the reasons we were so, I hope, fierce about, if you spread this, if you bring it into a confined area, corrections, jails, nursing homes, no one in any of those environments, irrespective of if it's a sentence by a judge that you have to carry out to be accountable to your community, or it's someone who's dependent on a system of care, they didn't invite these risks or this pandemic. Nor did anyone in the state say, good idea, let's see what kind of theories work in a pandemic. It is clear to me that we've never invested as a country in public health. I'm proud that we've got a secretary who is also fiercely dedicated to making sure that we keep investing and building in public health. I would hope to think that she sees the benefits of when I was in the department. We built a brand new lab. We've been investing in instruments. I mean, we are clear. You always have to be prepared. Now, to your point, I think I've made some headway actually with the federal government to undertake in the federal corrections and immigration detention to do more proactive work. And I don't think it's ever too late, right? I think that masks and other activities and not letting anybody in can really mitigate, and everybody there, including the workers, our correctional officers and the inmates, all deserve that we do everything we can to protect them, and we're making headway. You might remember that you said, well, what else can you do? And I said, you know what? We have control, and I mean that in a productive professional context, of the contractors like the healthcare providers who provide the same kind of effort to provide medical care in a federal institution as they do in a state institution. And they're beginning to improve their infectious disease practices. And like Cook County, right, where they really recognized that when they had this, they started testing, they began to have cases, it spread in the same way we're seeing spread in New Mexico. They realized that they could take individuals immediately positive and move them to a safer, more COVID-contained location. So we're trying to figure that out with with the old Metropolitan Detention Center in Bernalillo County, and looking for strategies to do that. It didn't work as well as we wanted it to in a nursing home population, but they're much more difficult to transfer because there are real health care risks to transferring individuals. And then we worry about people coming out of hospitals who could bring COVID into a nursing home. So we try to make sure that we do isolation, quarantining, convalescent care before we go back into a congregate setting. We're trying all of those aspects. So I'm going to wrap it up in this way. Are we concerned? Yes. Is it an area where we will continue to do surveillance? Yes. Are we asking everyone on the state side, no visitation, masks, more telephones, more surveillance, all of the proactive things, and to really pay attention? Once you have one case, you have risk. You get that one case as quickly as you can, if it's an officer, out for at least 14 days until you have 2 negative tests. You can't go back to work. Really making sure, and I'm going to work with the federal government to meet those same standards, and to look at what Cook County did about taking people who were infected out and minimizing the rate of spread. It will continue to be a source of real frustration because nobody in the state of New Mexico in this administration thinks that that is an okay situation to walk away from. Nor are we happy about the rate of spread. So we are trying a number of things, and we'll continue to reach across to different states to see what the best practices are. It continues to be elusive, I think, on the state sides around the country that this is a highly infectious disease. And once it's in a confined area, even though we stop what we're doing, we clean it up, we test everyone, we isolate individuals, including inmates, we have staff not come to work, it doesn't appear to be enough, and we're hoping to get a different result around the state than in Otero County. But I appreciate that the second we have another strategy to the internal isolation and external isolation, I will bring it to you and we will talk about it at this press conference. And it's one of the reasons that we tried to be so aggressive with surveillance. So thank you again. And to all those families, we are doing everything we know to do based on science, isolation, surveillance, and good preventive protocols inside our corrections institutions. And again, last thing, and I hit it several times, I believe the feds are going to be much more cooperative going forward.
Thank you, Governor. Next, I'm going to go to Morgan Lee with the AP. Morgan, you're unmuted. Go right ahead.
Hi, thanks for this opportunity. I wanted to circle back to if you would, Governor, what you were saying about masks being one of the major problems. And I'm wondering if you're suggesting that there's going to be sanctions. What are they going to be if someone's not wearing a mask? Are they going to receive a ticket? And is there a double standard here? I'm wondering, in your opinion, you mentioned somebody, I don't know the details, on Facebook holding a party. But there was also just a little while ago a state senator who came to the session, the building you're in right now, and didn't wear a mask for 3 or 4 days. So what are the consequences going to be going forward? And do you regret not enforcing more strictly previously?
It's a $100 fine, and for businesses that don't work to enforce both with their employees and with folks visiting a business, the mask requirement, that business owner gets a $100 fine and a misdemeanor citation. We've done everything that you do. You know, we know this. This is public health evidence-based information, which is you do far better by getting people to have behavior changes on their own. They last longer, there's less debate about them, and people actually help you promote the science behind the mask. I don't understand. I would guess this is true of every elected leader. I don't understand how masks became political. Right? Now, I never ask anyone who, my dentist or the hygienist or someone with a procedure, you know, whether they think wearing a mask is good practice or not. I'm always grateful that there's gloves and masks and they're treating me with respect and making sure that they don't infect me with something and vice versa. And I believe that we had good responses. We did flatten our curve. But the fact that there's no federal mask requirement and that far too many New Mexicans became very lax. We saw a real effective effort at the onset, the front end, largely our urban areas. Anecdotally, remember I said people can call us up, we'll go out there, state police and others will remind you to wear a mask. So, and social media, in fact, is a place where people can get more than just anecdotal evidence. They can see the likelihood that you're moving around, the likelihood that you're having a party. They can demonstrate the number of users, whether they're using masks in their posts and their photos. So you can actually use it to count and get a real sense. I'm disappointed that too many New Mexicans didn't take this seriously, and that too many New Mexicans created a situation in too many states around us where we didn't go to phase 2. That they're putting restaurants as a particular group and our breweries in grave danger of not being able to expand or stay open. And I'm really disappointed in that behavior. And what appears to be also the case in New Mexico, and we're going to use LANL to help us create modeling for mask wearing, and also we'll be giving out these $100 fines to individuals who are not wearing masks and asking local government to assist us with this. But so we'll know unequivocally how many fines we give. But we flattened the curve because people just did what we asked them to do. Other states did not flatten the curve. We're beginning to see an uptake as we introduced risk. Too many businesses, you know, aren't asking folks to wear masks. So I'm now willing to protect kids, save lives in exactly the way I said I would more than 2 weeks ago. That if we couldn't maintain adherence, I would go to enforcement. So I think I've done everything I said I would do in exactly the way that I said it. And when we've done it in the way that we expected people to respond, we flattened the curve. I expect that we will again. And now we've got 21 states. Pennsylvania is going to mandatory masks because it works.
Thank you, Governor. Next, I'll go to Brandon Evans with KRQE. Brandon, you are unmuted. Go ahead and ask your question.
All right, pardon me for just a second. I had to pause the stream, but good afternoon, everyone. Just one question today, as instructed last week by the governor. And mine is on casinos. So casinos not on tribal land are closed, and racetracks can run horse races without spectators. So my question is, can people make bets at these casinos on these horse races, whether they are happening in New Mexico or at any other racetrack across the country?
So you have identified what is a problematic inequity, and I want to be very clear and fair to the sovereign nations who are sovereign. And not all the gaming tribes have opened. They all closed when we were early in the pandemic, and every single one of their leaders continues to hear from me, one recently in northern New Mexico right before this press conference, that I really want to make sure that their COVID-safe practices, that they're adhering to them, because we got some complaints that they were not. We don't want to create these inequities. The whole point about allowing some of these horse races to occur was to make sure that that we could maintain the horse racing industry. Trainers and jockeys tested have to be quarantined in the area in which they are. We don't want them moving around, and we don't want any spectators. Are we creating an unfair inequity in the Native American gaming enterprises? Possible. And frankly, my preferences, which I've made clear, is I don't think that they should be open. I think it's too much risk. And they are requiring people to wear masks, and they have done social distancing, and they're metering as a result. And all of the ones I believe that are currently open are requiring people to have a gaming card so that they can do contact tracing. But I don't think that it is effective introduction of risk currently what we see going around the country, and that it creates an unfairness to not having spectators socially distanced wearing masks at racetracks. But we're not in a position where I can affect that inequity except this. If we wear masks and we flatten the curve and we lower it, and we can introduce some more risk, as long as we do that thoughtfully and carefully. But you have identified and exposed, right, an area where it becomes really problematic. And we hear from the industries who are not on sovereign nations, who are subject to our public health orders, who are concerned that business is taken away from them and going unfairly to another business enterprise. And we heard it in our early public health orders. I'm a small mom and shop, but a big box store. And again, it wasn't about the issue about are we being fair to a big box or Native American gaming. We were trying to prevent people from moving around, but recognizing that I can't prevent folks from getting groceries at a large big box store because we need to have access to supplies. So it's a disturbing issue for us, one that we don't have total control over, but one that we continue to tell our gaming tribes that we would like them to behave in a fairer context, and it's one that we can take back to them again, and I appreciate your question.
Thank you, Governor. Next, I'm going to go to Peter Goodman with KTAL Radio. Peter, you are unmuted. Go ahead and ask your question.
Okay, can you hear me?
Can.
Yep, go right ahead.
Okay. Governor, everything you've said seems right on the mark, but the facts on the ground in Las Cruces, at least, are different. Maybe you heard about Lynn Moore, who tried to urge some people at a Walgreens to wear masks. She got smacked in the face by the guy. When she asked the Walgreens people, they did nothing and said, corporate told us not to bother with that enforcing mask stuff. When the cops came, the Las Cruces cops, they said they don't enforce the health order. So what should Lynn do, or any of us, or what should your office do to make the outside world conform to what you're quite correctly ordering?
Well, I really appreciate that, and the thing I can do right now is to apologize to Lynn. No one should be subject to such inappropriate and ineffective, and the issue is I hope that the police cited the individual who assaulted her. That is a crime, whether or not there's a debate about enforcing masks. It is outrageous that someone would react to her reminding them that there is a mandatory wear mask in effect. And we said, you know, we're not going to cite people. We want positive peer pressure because, again, we have scarce resources. There are real issues. There's traffic accidents that we have to respond to, and we do. But saving New Mexico lives requires now that our police enforcement folks, our police officers, men and women, are going to have to cite New Mexicans because they aren't doing it. I'm going to call Walgreens, and we have talked to many of our, what we identify large chain stores, that we expect them to behave in a way that promotes good public health practices and protects their employees. They will get an OSHA violation. They will get a misdemeanor violation, the owner of that particular store. They will get a $100 fine for someone not wearing a mask. So this is exactly the kind of situation. Twofold. One, we're putting all New Mexicans at risk. And two, individual New Mexicans and businesses are really failing to help us, right, support each other in this effort. And now we're going to ask businesses, we're going to move from asking them to good partners to mandating that they're good partners. And as for the Las Cruces police, the same thing. We expect them to help us. And if they don't enforce, they're subject to the same kinds of liabilities. And again, the question is, I think people, and I appreciate that you said we're right on. I have no doubt that this is going to be the reactions are not all going to be positive. I want folks to be able to operate post-pandemic in the most independent, law-abiding ways possible. I was hopeful that a public health order, a piece of paper from the Secretary of Health telling you, I want you to save New Mexico lives and to protect our healthcare workers and our businesses. What about all the local Las Cruces businesses who are adhering to the highest degree at their own expense for masks and COVID-safe practices at limited capacity? They're all at risk because somebody went to Walgreens, had the audacity not to wear a mask, and then assaulted another individual who was shopping there who's at risk because they're not wearing a mask. So we're going to do this. We're going to hold everyone accountable. And I frankly wish that we didn't have to do that, that our own individual behaviors were enough. But I appreciate your pointing out that. And to Lynn, I'm very sorry that this happened to you. It should not have happened to you. And I certainly hope that the police officers who showed up cited the individual who assaulted you. That is a crime.
Thank you, Governor. Next, I'm going to go to Tommy Lopez with KOB. Tommy, you are unmuted. Go ahead and ask your question.
Hi, guys, and thank you. I want to circle back to the travel restrictions and ask two basic questions. One on enforcement. Will state police have any role in enforcement if they learn that someone has come from out of state? Perhaps they pulled someone over or they find out in some other way. And then two, on exemptions. Are people who live in border communities exempt if they perhaps live in El Paso and work in Las Cruces, or vice versa, or if people are going to necessary appointments like doctor's appointments or anything like that? So are there any exemptions? Thank you.
So to the first, yes, the state police and other, we hope, law enforcement. So if you pull somebody over without, that's, let's say, I hope it's all of these things, that they were going just over the speed limit, so it's not reckless driving, and they were endangering a bunch of lives all at once. That in pulling you over, there is you're in an out-of-state vehicle, so it's clear your license. They cite you because you're not wearing a mask in my hypothetical, and you get a traffic ticket. So now you get 2 New Mexico tickets, and we're going to give you a ticket for also not, we're going to ask you why you're not quarantined. All of the above. And I think that it will be difficult to do that. We will not see everyone who is coming in from out of state. We will not know whether or not people take the quarantine as seriously as we need them to. We will need New Mexicans, do not put yourself in harm's way, but to let us know so that we can enforce. And I wish we weren't in that position, but I think the risks are great enough that we just are asking people to delay their trips here. Delay. Let's get the states all across the country to get their curves flattened. Let's get back to a productive trend in this country, and let's not invite risk where we don't need it. And if you have to come here or you already have a vacation, I'm going to tell you that I want you to quarantine. So if you're out, that is a citable offense. We are going to ask you about that. And again, can we do that? Is there going to be some large, blockades and stings? There are not. We don't have those resources. It doesn't make any sense. We have to keep New Mexicans safe in a number of other ways. Yes, if you're a worker and you are required to come in, and you're coming in, you live in El Paso and you're working in Sunland Park, you're exempt. In the same way that you were exempt, nothing's changed in that order. Except this is an opportunity for me to ask those employers, if you are not required to be present, we do not want you commuting across the border. We want you to telework from home. You are bringing risk or taking risk. And we want to be very careful about that, and I'm concerned about it. So we want to go right back to those employers. Please, if you've got folks that you can support to telework from home who are commuting from out of state, Texas border, Colorado border, Arizona, Utah, please don't do it. If you're a required worker, you cannot go to work if you're sick. If you're an employer and you allow that to happen, that's an OSHA violation. Those are significant. If you're required to come to work, we expect you to adhere to COVID safe practices. You will have a mask on. There are many businesses that are doing temperature checks, that are using apps on people's smartphones so that they do a check-in. I don't think I have a fever. I feel just fine. I don't have any other symptoms. I'm not sneezing. I don't have an allergy. All the things that give us heightened awareness and that you're socially distancing your employees and you're keeping to our restrictions in terms of the number of employees per business that you can have. So exempt, just like in the order, same order applications still apply. Nothing has changed. I'm working hard not to have to roll back phase 1B, which was gyms, limited capacity, salons, etc., wineries. We don't want to go backwards, but if people aren't adhering and we have too many out-of-state travelers and they're bringing in risk, then that's exactly what will happen in the state.
Thank you, Governor. Next, I'm going to go to Jeff Proctor with, I'm not sure which he's with today, New Mexico In-Depth or Santa Fe reporter. Jeff, you are unmuted. Go ahead and ask your question.
Thanks, Nora. I want to drill down a little bit on the question that Algernon asked, but my question is specific to the state inmate population at the Otero County Prison Facility, and the question is for the governor. Your April 6th executive order excludes anyone who has ever been convicted of a state sex offense from early release, regardless of whether they are currently serving time on a sex offense now. That's a much higher bar than for any other offense listed in the order. Given that every person now locked up in Otero County fits that category, and especially with a COVID-19 infection rate of 80% in one of the state's most crowded prisons, and how important social distancing is to stopping the spread, why haven't you considered amending that executive order, particularly the sex offender exemption? And is that something that you are planning to consider going forward? Thank you.
So, Jeff, I'm not planning to amend that exemption. When I'm balancing risk, sex offender issue risk in the general public versus the other categories and the 19 individuals that we've recently pardoned. But it doesn't mean that they are, as we figure out maybe in that Otero context, is there a way to do better isolation? We are open to all of those, and as you know, that is where sex offenders are placed in our correction system in the state, which is, why you can have a category that looks like there's something going on with individuals who are convicted of a sex offense. They're all in the same state facility. One thing we may have to think about in a pandemic, and we don't have options, is there a capacity issue in a prison? And I've been asking, it's something I didn't refer to in the other question, but Jeff, is there a way to identify a building and have sufficient correction staff so that you limit capacity? We haven't found that option anywhere except in potentially moving COVID positive to, say, working with the Bernalillo County on their vacant site or empty detention center. It's tricky, and I appreciate the questions. If we had an easy answer, we would provide an easy solution. I think the decisions that we've made for this population and their incarceration are the right ones. Do I wish there wasn't a pandemic? And do I wish that pandemics weren't particularly problematic in confined spaces? All of the above, and they are, which is why we worked so hard to try to prevent it from coming in the first place, and we were not successful at doing that. Next question.
Thank you, Governor. We have a couple more questions. Next, I'm going to go to Matthew Reichbach with New Mexico Political Report. Matthew, you are unmuted. Go ahead and ask your question.
Hi, Governor and Secretaries. Thanks for this. I just had a couple of questions. One, are masks required while you're in your car? As you mentioned in your earlier example from folks who are traveling out of state, you said they could be ticketed for that. And also, why hasn't the state released the number of confirmed cases in county and regional detention centers as they do with those in state-run facilities? Thanks.
And so I'll do the latter part first. You know, we collect all of that data. We try to release data that gives people a sense by county of all of the cases. We talk about where we have outbreaks and where our rapid responses are. We have the data about how many positive cases are in state versus federal correction facilities, and maybe the best thing to do is to provide that to you directly, but it is available. We may not be releasing it as part of our data every day, but we have all of that data. We know by zip code, we know by often occupation, we know by correctional facility, we know whether it's staff or it's an inmate, whether in a nursing home, whether it's staff or a resident. We are, and we continue to refine getting the data. So as an example, early on, you know, we had a really broad healthcare category, and as we're doing more work to sort of peel away, is it doctors, is it nurses, is it CNAs, is it, so we really know what our exposure and transmission rate risks are. So we'll get that to you because we absolutely have it. And in fact, I brought it for the last press conference so that I could look at it and see exactly how many cases and get ready for, you know, once you get it in, we get very nervous about that. So if we want to list them, we can, because Dr. Scrace is right here. He can pull up that data because we have it in the database. And so, you know, I gave the example if they pulled you over. If you had no mask, couldn't point to them, I don't believe that we're going to be looking for people it's out in public with your mask. But you know, Dr. Scrace showed you how he's wearing it like this in the car. I wear mine in the car. I do sometimes. I have been known to take it off in the car because somebody can't hear me. The difference is that I'm never alone in a car. And so somebody else is at risk. So the folks who drive me are never without their masks. It is mandatory for the security detail to have a mask on in the car. And I work to adhere to the best practices of mask wearing. So I try hard not to be on the telephone when I'm in the car so that I can protect the state police detail from me. While we're in the car. So, but to answer your question, I don't think that we consider a car a public space. So you're not required to wear a mask in your house. You're not required to wear it in a car, but I wanted to point out that if you're here and you don't have masks and you're speeding, I mean, we're going to talk to you about all the things that you can be cited for. And if you're in public and you're not quarantined, you're an out-of-state visitor, those are going to be conversations that could be citable. So that was a good clarification, and I appreciate the question very much.
Thank you, Governor. This will be our last question, going to Bonnie Gordon with the Los Alamos Daily Post. Bonnie, you are unmuted. Go ahead and ask your question.
Hi, thank you very much. As medical professionals become more familiar with treating COVID-19, are hospital stays becoming shorter and are fewer people needing to be in the ICU? And also, how is the pandemic affecting other kinds of hospitalizations and treatments at the hospitals?
Thank you for the question. And so I'm going to have Dr. Scrace close us up with answering that question. And if Secretary Kunkel has anything to add, we do know that clinically that patients who benefit from, say, remdesivir, which we get allocations of, and they all go to there's requirements about going to a research institution, they go to UNM, they get distributed, that they do, in fact, shorten the treatment at a hospital and have a positive impact on the treatment of individuals infected with COVID-19. I don't know that and I haven't asked in a while exactly what that impact is on our hospital stays here, but it does have an impact. And there are debates and discussions all around the world about additional treatment modalities. And of course, we are now really focused on whether or not we'll have a vaccine in the late fall, early winter, so December, January, and everyone is cautiously optimistic about that, but that's a pretty short turnaround time. But the whole point, that's why this is so much different than the flu. A, it's not the flu. B, incredibly contagious. C, for certain population, incredibly high mortality rate and hospitalization rate, and there's no vaccine. Flu, for many strains, a vaccine, so that you can protect nursing home residents, corrections populations, teachers, healthcare workers, school-age children, individuals with autoimmune disorders as a category, for example, people undergoing cancer treatment who are in situations that can't take on any kind of other infectious disease, cold, flu, anything other than that. So this is why this is so heinous, and you gave me an opportunity to remind people about why this is such a problem, and there are lots of unknown long-term chronic issues that we are beginning to get data about that are quite concerning. Dr. Grace.
Yeah, you know, that's a great question. I want to thank you for the question, too, because I don't know the answer. The governor touched on the main point, which is that New England Journal of Medicine article we talked about last week. Remdesivir will shorten the length of the severe illness by about 4 to 5 days, from 15 days down to 10.5 or 11. It also reduces mortality rate by 5 to 7%. So we think with treatments, we'll see some shortening. I would also opine, not data, that as the population shifts to a younger group of people, we might see faster recoveries, but we don't know that yet, but we'll check, and our delivery system people can tell us that. I think a really important opportunity you've given us is to talk about, well, what's the effect of the pandemic on our for people who don't have COVID, and it's been substantial. We've seen a significant increase in our own ICU beds. Our hub hospital ICU beds have been above the baseline capacity, like full, more than full, for over a month. And a lot of it, I'm told, is from folks who delayed care, maybe diabetics with more serious issues controlling their diabetes, who delayed health care and then got out of control and required hospitalization, or people who had a minor infection that turned into a major infection. So we're still reminding people to seek necessary care. Stay in tune with the cycles and your prescription refills and the like. If you're on high blood pressure medicine, don't let that prescription expire. Probably you can have an online visit with your physician, get that filled. I'm starting to see patients again in this month and a little bit, and a lot of our practices changed, and there's a lot more online. But please don't drop that necessary routine care, because it's just another way to increase the stress and overfill the capacity of our ICUs here in New Mexico. I will circle back, though. We'll look at that data this week on length of stay and see if we are noticing any trends.
All right. I want to thank everyone who tuned in. I wish we had better news, but it's not the worst news. No governor wants to wake up and look at the national data and see that you were green and now you're red. Some days we've been orange. Nobody wants to see, right? I get case briefings every day. I compare them. I go 7 days back, 5 days back. I often like to get kind of a glimpse of 3 days and then ask, I hope, provocative data questions that they never take out of a meaningful data set, but to really get a sense about where we are. These are concerning trends. We are going in the wrong direction. I stand behind delaying phase 2, which we said we have to be meeting our gating criteria. We are not. That's clear, so you can't go to phase 2. I don't think it's too late for us to stem the tide, to get back to a place where we flatten the curve so that all of the introduction of risk that we have made, supporting, right, a steady, slow, smart, productive reopening of the economy, which we need. And we do have isolation and COVID-19 fatigue. Everyone in the world, I have no doubt, has COVID-19 fatigue. I will tell you unequivocally that these two incredible secretaries have COVID-19 fatigue and haven't had a day off in 6 months. So everyone wants to get outside. Everyone wants to celebrate Independence Day. Everybody wants this to just go away. I can't see it. I'm not sick. I don't need a mask. I don't get out that much. I went to one thing. I'm outside. It's safe. I can play softball. I had one event. It was one small family gathering. They're all inappropriate. They bring risk we do not need. I'm cautiously optimistic that we will get through the next 14 days with trending in the right direction after we finish out our increased or too high, 7-day high average caseload. I am confident that we get back to our gating criteria in the next 14 days, assuming people wear their masks and limit their outdoor or their traveling around in their communities. Let's do this together. Let's create a situation where we don't issue one $100 citation to anyone. Let's show the rest of the country that we can have a statewide strategy that's meaningful. Let's not forget that we're all in this together and that we can get through COVID-19. We can get through anything. We're New Mexicans. And we can do that by respecting each other and being kind to each other. And we can celebrate Independence Day in any number of individual at-home ways. And I can't think of a better way to recognize how proud and patriotic we are of this country by recognizing that I have the utmost respect for every single American and New Mexican. And my goal is to do everything in my power to keep you from getting sick and to save as many lives as we can. Thank you very much for tuning in. I do want you to have a successful Independence July 4th weekend, and I want it to be safe. And I want you to remind those that you love that we're going to keep each other safe, and that's how we're going to celebrate this July 4th. Thank you all very much.